Hello everyone, myself Dr. Umarani, Associate Professor in Department of Anatomy. Here I am going to explain about October-November 2020 KNR UHS First BHMS Anatomy Paper 2. So this is the question paper. Here that essay questions are: first question, surface markings, blood supply, conducting system and applied anatomy of heart. Second question, external features, relations, supports, blood supply and applied anatomy of uterus. The 5 mark questions are: femoral triangle, rectus sheath, stomach blood supply, arch of aorta, histology of kidney, internal iliac artery, portal vein, sciatic nerve, histology of testes, ligaments of knee joint. Here these are the 2 mark questions, and in this video I gave brief description of these 2 mark questions. So hilum of the lung. What is hilum? Hilum is the area on the mediastinal surface of the lung through which structures enter or leaving the lung. Here a short broad pedicle known as the root of the lung, which connecting the medial surface of the lung with the mediastinum. Here it consists of structures entering and leaving the lung at hilum. So the arrangement of these structures in the root of the lung at the hilum, they are from before backwards, they are similar in both lungs, whereas above downwards the arrangement will be different in right and left. Before backwards, that arrangements of structures are pulmonary vein, pulmonary artery and bronchus, whereas above downwards it is differ from right and left. On the right side it is epiarterial bronchus, pulmonary artery, hypoarterial bronchus and inferior pulmonary vein, and whereas left side it is pulmonary artery, left principal bronchus, inferior pulmonary vein. So this is about the hilum of the lung. The portal triad, so it is present in the liver. The structural and functional units of the liver is hepatocyte, and these hepatocytes are arranged into small polyhedral hepatic lobules, and each lobule has 3 to 6 portal areas in its periphery, and a central vein is located. And here portal areas at the corners of the lobules consisting of the tissue in which a branch of portal vein and branch of hepatic artery and a branch of bile duct is located, and all these 3 structures together known as that portal triad. The venule contain blood from the superior and inferior mesenteric and splenic veins, whereas arteriole contains blood from the celiac trunk of the abdominal aorta. Duct carries bile synthesized by that hepatocytes and emptied into hepatic duct. McBurney's point. So it is related to that appendix. The inflammation of the appendix is known as that appendicitis. Initially, the pain at appendicitis referred at umbilical region because the umbilicus and appendix both having that same segmental nerve supply, that is T10. Gradually, the pain is localized in the right iliac fossa. So on palpation, the maximum tenderness is elicited at McBurney's point. It is the point on the surface of that junction of medial 2/3 and lateral 1/3 of a line which is joining from umbilicus to anterior superior iliac spine. So if you draw a line from right anterior superior iliac spine to the umbilicus, it is a midpoint between medial 2/3 and lateral 1/3. There maximum tenderness is present at appendicitis. So this point is known as the McBurney's point. Name the tarsal bones. These are the short bones. These are 7 in number. They are arranged in 3 rows. Proximal and row consisting of talus and calcaneus. Middle row consisting of the navicular. Distal row consisting of 3 cuneiforms and cuboid bone. And these tarsal bones can be remembered with that mnemonic known as tall camels never consume cubes. So T talus, C calcaneus, N navicular, and C for 3 cuneiform bones, and C for that cuboid. Parts of the penis. Penis is the male organ of copulation and it is traversed by the urethra, which provides passage of that both urine and semen. And it consisting of two parts. So root or attached part, it is situated in the superficial perineal pouch, whereas body or corpus, it is a free pendulous portion. The body of penis is divided into three parts: body proper, neck, glans, penis. Classification of ribs. There are 12 pairs of ribs. They are classified according to features into typical and atypical ribs. Typical ribs having same general features. They are 3rd to 9th. Atypical ribs having the special features. According to relation with the sternum, ribs are true ribs and false ribs. True ribs are upper 7 ribs. They articulate with the sternum anteriorly. Whereas false ribs, they do not articulate with the sternum anteriorly. They are lower 5 ribs. According to its articulation, vertebrosternal ribs, vertebrochondral ribs and floating ribs. Contents of inguinal canal in male and female. So what is inguinal canal? It is an oblique intermuscular passage lying above the medial half of the inguinal ligament. And this inguinal canal extends from the deep inguinal ring to superficial inguinal ring. The contents are differ from male and female. In male, spermatic cord and ilioinguinal nerve. In female, round ligament of uterus and ilioinguinal nerve. So next question, sites of narrowing of the ureter. The lumen of ureter is not uniform throughout and it presents 3 constrictions. One is at pelviureteric junction, where the renal pelvis joins the upper end of the ureter, and the second constriction when at the pelvic brim, where it crosses the common iliac artery. Third, narrowing at uretrovesical junction, where ureter enters into the bladder. Next is the adductor canal, also known as subsartorial canal or Hunter's canal. Anterolaterally, it is formed by the vastus medialis. Floor is formed by the adductor longus and adductor magnus. Roof is formed by the sartorius. And the contents of this canal are femoral artery, femoral vein, saphenous nerve, and nerve to vastus medialis. And what is the clinical significance of adductor canal? The femoral artery is exposed and ligated in the adductor canal during the surgery of aneurysm of the popliteal artery. That is dilatation of the popliteal artery. So because the artery at this side is very healthy and does not tear when tied. So it may tear when this artery is tied in the popliteal fossa. So this procedure was first performed by the famous surgeon, that is Hunter, and the adductor canal was named after his name as Hunter's canal. So last question, parts of the male urethra. Male urethra is 18 to 20 centimeter long and it transmits urine and seminal fluid, and it extends from internal urethral orifice at the neck of the urinary bladder to external urethral orifice at the tip of the glans penis. And according to its location, the urethra is divided into 3 parts. Prostatic part, it is 3 centimeter long and it is widest and most dilated part of the male urethra. Membranous part, it is 2 centimeter long and it is narrowest and least dilated part of the urethra. And spongy or penile part, 15 centimeter long, it passes through the corpus spongiosum of the penis and it terminates as external urethral orifice just below the tip of glans penis. So these are the brief description of 2-mark question. Students, you can prepare same way 5 marks and 15 marks question. So thanks for listening, and if you not subscribe this channel, do subscribe and give your valuable comments in comment section. Thank you for listening.